Welcome to COVID-19 Beyond the News. We're the School of Community Health and Policy here at Morgan State University. The COVID-19 virus has come into our lives with very little warning. We've gone from communities who gather together to individuals who have to be socially distanced and wear masks to protect ourselves. Information about the virus consumes us every day, from our top news stories to our states giving us up-to-date information, from the statistics that are being shared to the messages we receive, all tell us that the virus is present and taking over our communities. Morgan is an historically Black institution and is Maryland's preeminent public urban research university. Within our school, we train a diverse body of health professionals and have a vision and mission centered on urban communities. For all these reasons, the coronavirus pandemic, as it is currently running its course, is an issue that bears our attention. As community engagers, as researchers and practitioners, as faculty, students, and administrators, we know we can and should be a resource to communities. After all, it is who we are. Rumor has it that some groups can't get the virus. That is just not the case. Everyone is at risk. But we don't want the risk to overwhelm us. There are things we can do and are doing that have proven effective against the virus. We should all know them by now: social distancing, hand washing, and the wearing of masks. Unfortunately, it is the case that certain groups are experiencing a disproportionate burden of the disease. That's African Americans. You might ask, why is this happening to African Americans? But here is what we know and understand so far. For a number of individual and societal reasons, Blacks have multiple illnesses at higher rates than other racial ethnic groups. In other words, generally less healthy. They're also more likely to be in jobs that place them at risk for the virus, less likely to be insured, and less likely to have access to adequate medical care. These aren't all the reasons, and it is not the case for every Black person. We do need the research to learn more. Here is what we plan to do, at the very least, to make our contribution to addressing the virus and serving communities. Knowledge is power, and facts matter, so we want to be a link to reputable information. Expertise is found everywhere, not just in academic institutions, government agencies, and research laboratories. So we need to hear lots of perspectives and voices across the spectrum so we can adequately deal with the virus as both a medical event and a social phenomenon. And lastly, we do plan on carrying out meaningful research within the university and all of our partners outside the university. As we close out this conversation, we just want you to know that we are here, part of the network of resources responding to the coronavirus pandemic. And on behalf of the School of Community Health and Policy here at Morgan State University, please stay connected, stay safe, stay informed, and most importantly, stay well.